Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. Cece, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Anna Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health.
Welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. Cece, functional medicine nurse practitioner, self-proclaimed toxin tamer, and crunchy mama, and our crow host.
Oh!
Over here.
I'm Anna Kate, your medical mystery overachiever and discovery liaison. And today we're going to talk about just what you should do for your yearly wellness and what you should be asking your practitioner, and something just to keep track of for yourself. This is kind of right up this is my favorite thing. And I think practitioners like when I come in with prepared with my binder.
Yeah.
And we'll talk about that later, but it's here, and it may be too much, but I have it all.
Yeah. And to your point, it's super important to know your body on paper and your baseline. And so there's going to be kind of two parts to this little mini-sodes. The first one, I just want to talk about yearly wellness. Like, what does that mean to me if a patient comes to me and says, I'm great, no symptoms, like just do a wellness panel. Okay. What does that look like to me? And as well as kind of just staying well in terms of supplementation. And then part two is going to be more along the lines of how we interpret those labs and things that we should know about, like, hey, it might look good on paper, but it's not optimal. Right. It's not out of reference range. Someone else might say that it's normal, but to me, it's not.
Right.
And so that's where knowing your baseline and fluctuating from your baseline is really important.
Right. So it's important to have, your baseline, and that's your reference range.
Yes.
And that's where we start if you're feeling great. And I say I'm the one reading these labs, but as a patient, I know the trajectory and the pattern of all of my labs. So,
a practitioner who sees you one time a year
is not going to,
or who's never met you,
is not going to see that pattern.
Exactly. And so keeping that pattern, and not everybody fits in the box.
Right.
And so if you've had a white blood cell count, that's lower end since you were 2 years old, someone who just comes in once in your life as a practitioner sees that, they might think it's odd, but to you, that's your baseline, that's your trend.
And I was going to say that because I've had a chronically low red blood cell count and a chronically high white blood cell count because I've been fighting a bunch of snot.
Yeah.
But when I take that paperwork in and show them, and like when my hematologist draws my blood and they're like, hey, this is off, this is weird, your iron's low. Like, okay, well, here's what it's been for the last 12 years. This is my pattern. It's actually
pretty good for me.
Yeah. So that it's gone up from the numbers that you just drew. That's great. I'm trending in a positive direction on getting that red blood cell count and white blood cell count better.
Versus them thinking it's more of an acute issue.
Right.
So,
and you won't know that unless you're doing annual labs, or at least every couple of years if you're feeling great and you don't really have anything going on.
And this always blows my mind. So if you go to, let's say someone has to get a physical for work and they go to a PCP. Okay, that PCP in a yearly wellness panel is running a CBC and a TSH. Like, usually that's it. And so when I do just a yearly wellness panel on patients, they're like, whoa, this is so intensive. This is so, like, I've never seen my body on paper like this. And to me, I'm like, it's so simplistic for what I deal with every single day. But it's just mind blowing that we don't know these things, that we save these labs for when there's a problem. Instead of knowing all these different levels about ourselves and how they're changing. And that to me is how you would be preventative, is being able to track. You're not daily, right? Like we're tracking macros, but yearly tracking and just, seeing it on paper and seeing how your body is fluctuating. Why are we saving these awesome labs until there's a problem?
Right.
So in very general wellness, I'm always looking at immune function. I'm looking at something called a CD57, which are our natural killer cells. It basically tells me if your frontline soldiers are deficient or overactive. I am looking at a CBC, which includes white blood cells, red blood cells, and all their ratios.
Yeah.
We can tell a lot, and we'll talk about this next mini-sode. I can tell a lot about a patient about those ratios of the white blood cells. I'm obviously always looking at your sugar and your electrolytes and your liver function and your kidney function. Um, Micronutrients is something that's
Yeah.
insanely important. So at minimum, vitamin D, B12, folate. At maximum, if a patient's like, I want to see all of them,
I want the full thing.
then amazing. Yeah. Then I'm looking at a huge micronutrient panel of all our vitamins, minerals, even detox, like antioxidants, intracellular and extracellular. So in the blood and in the white blood cells, which is super cool. That's very, very thorough. And it also tells your body, like if you're on baseline supplements, it tells you what your body needs more of.
Yeah, or if you're actually absorbing what you think you're taking.
Or if you're absorbing it, right. Maybe we need a different form. Maybe we need to switch supplements. Hormones, obviously this changes for men and women, and depending on if it's a kid, the age of the kid, but always looking at, for women, estrogen, progesterone, DHEA, DHT, testosterone, men similar, but a little bit different there. Full thyroid panel.
Yes. Full everything.
Not just the thyroid stimulating hormone, but the actual hormones that your thyroid is producing, your T4, your T3, how it's being taken up, how it's being released. Iron, how iron's being bound to the cells, as well as ferritin, because I use ferritin kind of as an inflammatory marker, as well as the carrier protein to iron. Immunoglobulins goes along with our immune function. So there's 4 that we look through at LabCorp: IgG, A, M, and E. And they tell me just how is your body handling chronic inflammation or acute inflammation or allergens or information stemming from your GI tract. It's very general, but when it's elevated or deficient, it tells me where we need to go if we need to go somewhere.
Yeah.
Cortisol and adrenal function is a big one too.
Yeah. Yeah. Well, and because you're doing this on a somewhat consistent basis over a decade period of time, that you know what your pattern is.
Yeah. Yeah.
Because your pattern is your pattern, not what necessarily the reference ranges are. So if your cortisol is great and then you switch jobs or something stressful happens and then you can't come back down from that, or you're not going on the cycle in the correct way, those are good things to know. Yeah. And also that if you do feel that there's something that you want your practitioner to have eyes on, that you test in a certain time frame based on when that's happening, because if it's not near the event, then it doesn't.
And we'll touch more on that. There's certain labs in our next mini-sode that I can't stand, that are drawn in the blood, that just need to be drawn in a more efficient way. So we'll talk about that a little bit more. That's a great topic. I love that. A couple other things that I like to look at, depending on the age or family history. If someone has a huge family history of GI issues or colon cancer or anything like that, rather than, let's say they're 35 years old, let's be preventative. Let's do a full GI map. Let's do a full stool test so I can see how are your inflammatory markers? How are your digestive markers? Is there fecal occult blood? How are you breaking down your hormones in your stool? And then just for wellness, how are your beneficial bacteria? How are the bacteria that can cause you to be more dysbiotic? Is anything being opportunistic right now? That is a great way to avoid future GI issues if you have a big family history, especially just for overall wellness. And then the last little thing I look at is what I consider my baseline. There's so many different labs that look at viral and bacterial loads, and there's no reason to go down rabbit holes for patients who are healthy.
Right.
But there's a line between going down a rabbit hole and being preventative. And so I used one lab that goes through insurance that covers I would say my baseline of viral and bacterial loads, where I can see if you've been exposed to certain things, if you're immune to them, awesome, but are they starting to become reactivated? Even if you feel really good, are they reactivated? Because some of these are highly linked to neurocognitive disorders in the
Yeah.
future. So depending on the age, we want to make sure those viral loads stay down, those bacterial loads are gone or aren't there because they shouldn't. You can't become immune to them.
Right.
And so I'd rather you also have a baseline of those titers, of those numbers. So you know as you progress through, okay, yeah, I have history of Epstein-Barr virus. It's there. We're going to stay immune to it. That's awesome. And my titer is nice and low, not causing a problem. And then you run it next year and you're like, whoa, this is way more elevated. I
Yeah.
still feel good, but this is elevated past my baseline. Okay, let's work to sit down a little bit.
Yeah.
And keep chugging along. So that is, to me, what I offer my patients, and also what I do personally outside of patients who have a history of certain chronic illnesses. I will throw that bacteria in there as well. So for myself, my yearly, just as, I don't know if it just satisfies like a little bit of the PTSD in me, but I always yearly check myself for Lyme.
Yeah.
And it's just part of me, my process and my healing. And, you know, I'd rather just know and see it and move forward. For a patient who hasn't gone through that, who is just strictly well, I would never.
Yeah.
But for some patients who have, then we just feel better getting a yearly check of, okay, I'm good here.
Yeah. Or a patient that has mystery symptoms that we can't pinpoint, then that's kind of a go-to to go and look at, hey, let's run a viral panel. Let's run a bacteria panel. Like, see what's hanging out and what's going on, because they can be sneaky and they can hide for a while. And so they might not show up on one, and
right. And,
you know, a stress event happens and they get, you know,
right. And that's why even on
activated.
Even on well patients who are just there for wellness, I still like to run kind of that baseline panel of viral and bacterial loads, because I don't know if that is elevated. I don't know what it's going to look like a year from now,
right?
5 years from now, right? It doesn't mean that you're symptomatic now, but could you be? Then I'd rather prevent that.
Yeah.
You know, or I'd rather prevent what we know neurocognitively that puts you at a higher risk in the future. I'd rather just deal with it and know now than wait till there is a problem.
Yeah.
So that's a really, really good baseline for overall wellness. In terms of just adult supplements, I feel this a million times by now. I'm a huge fan of rotating. Like, our bodies just get used to things very easily. And so I like to rotate, but my favorite just comprehensive multivitamin is Intramax by Drucker Labs. It is comprehensive. I mean, all your vitamins, your micronutrients, your minerals. There's even omegas in there. There's some detox kind of supplementation in there as well. I always add extra vitamin D. I think it's just so many of us are deficient. So I always add some extra vitamin D. Always have some sort of gut rotation on board, whether it's a prebiotic, probiotic, mega IgG or something, you know, good immunoglobulins, something for gut health on board. And then my last category is kind of miscellaneous, because it rotates through.
Seasonally?
It's miscellaneous. No,
they're not even seasonal.
They're not even seasonal. Okay. I mean, this is very personal to me and what I do, but it covers all my other bases.
Yeah.
So it covers detoxing. So I'll go through a phase of doing just one supplement for detox, and then I'll go through a month of adding in a mitochondrial support, like liposomal catalyst. I think if I had to break it down into two categories, it would be detox. 3 categories: detox, methylation support, and mitochondrial support. Yeah. And I kind of rotate through those. And we touched a little bit about this on a couple mini episodes ago, or mini-sodes. So that could be just good old-fashioned glutathione or NAC, or something like Dual Tox that's a little more comprehensive with some milk thistle and some other liver support in there. It can be liposomal curcumin. It can be liposomal catalyst, which is more of a mitochondrial support. It could be, if you're going, I also reserve that category for seasonal things. If you are super like allergic human, then throw in a good natural antihistamine in the spring and the fall. Kind of rotate in that category, but those are my big ones.
Okay.
Yeah, I'm choking on my spit, which is why I'm stopping talking right now.
Would you like to take a sip of your coffee? No. So there are lots of things and it's just kind of getting into that baseline of, hey, these are the things that we do every year. And these are the things that we do kind of on a monthly and daily basis of just having a plan, so that in the event that something goes out of whack, that you can pinpoint it relatively easily because you have yourself to compare it against. And in our next episode, we'll talk about kind of the reference ranges and kind of but really the reference range that matters is your reference range.
Yes.
So I highly, highly suggest that you do a lab panel of whatever you're comfortable with doing, just to keep an eye on even the big 10, like it's not actually 10 things, but just kind of the basics. And then maybe every 3 or 4 years, do a bigger panel of, brain, internal and external and all of those things, intracellular and extracellular.
Oh, yeah, absolutely. And that's very individualized too. Some patients are, because those labs don't go through insurance. So some patients are like, give me that information. And then other times it's really not necessary. Right. And you can go through just LabCorp requests through your insurance to get some of those micronutrients, to get vitamin D levels, B12, folate, magnesium. I would say though, like if we had to pick, those would be my top 4. And then if you're feeling like you're spending all this money on a great multivitamin, like something like Intermax, it's expensive, per month. So if you want to know that you're taking what your body actually needs, or you're absorbing it well, only then, and you're asymptomatic, you're super healthy, right, only then would I say dive deeper into more of an intensive micronutrient panel like Vibrant offers.
Yeah. Okay.
Yeah.
That's a great place to start.
So rules of thumb there. Our next one will be a good one with just understanding what's normal versus optimal, and also diving a little bit deeper into keeping track of your labs and how important that is. I
have a visual aid, so make sure you're watching.
Yeah, to just understand your body. So stay tuned, y'all. Until then,
let's discover together.
We hope you've enjoyed this journey of exploration and learning as much as we have. Before you go, we have a special request for you, our beloved discoverers. We'd be thrilled if you could show your support in a few easy steps. Step 1, if you're watching on YouTube, please hit that like button and subscribe to our channel. Don't forget to ring that notification bell so you never miss a moment of discovery. Step 2, if you're listening via Apple Podcasts, please take a moment to rate and review our show. Your feedback means the world to us and helps others discover our podcast too. Step 3, whether you're on YouTube or listening on your favorite podcast platform, please share the Discovery Doc podcast with your friends, family, and social networks. It's the best way to spread the joy of discovery. And finally, don't forget to follow us on social media. You can find us on Instagram, Facebook, and TikTok at The Discovery Doc. Stay connected with us for updates, behind-the-scenes content, and so much more. Plus, for exclusive content and additional resources, be sure to check out our website at www.thediscoverydoc.com. And while you're there, if you have a burning question or a topic you'd like us to discuss on the show, simply let us know. Thank you, Discoverers, for being part of our incredible journey. Until next time, let's discover together.
The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The hosts, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.